Hi, I'm Dr. James Grace. Today I'm going to answer 10 of the more common questions that we get from patients after they've had joint replacement surgery. The purpose for the compression socks are to prevent swelling and promote healthy circulation as the patient recovers after surgery. Typically, patients wear these for 2 to 4 weeks after surgery, or perhaps slightly longer if they still have some persistent swelling. Clicking is very common after surgery. After surgery, people have swelling about the joint. That causes the tissue to thicken. As tissues go through break-in periods, there's clicking and popping. It tends to get less over time. In therapy, they'll work that out. It's very innocent and typically disappears in 6 to 12 months. Yes, it will go away. It's extremely common to have swelling and warmth in the knee or shoulder or hip after surgery. As tissues are swollen, they will give off heat. That's a natural reaction to the swelling. As the swelling goes away, the heat will get less. When you're active, that causes swelling as well, and that'll cause heat. These are normal findings that will get less, and we seem to reassure people that this is a healthy response to their surgery, and it's a sign they are getting better. Your new joint will definitely set off metal detectors. The joints are made of a significant amount of metal, always picked up by the metal detectors. The TSA agents and the screeners at the airports are very used to this. There are millions of joint replacements done yearly. If you simply tell the agent that you have a joint replacement, they will either pick it up on the scanner or do a quick pat down and get you on your way in your travel. Our recommendation now is to take antibiotics for 2 years from the time of your joint implant. The reason for this is there's a good deal of bacteria in people's mouths, and when they visit the dentist and they have their hygienist clean their teeth, bacteria can potentially float around their body and settle in the artificial joints. So we recommend, as a safety, antibiotics for 2 years from the time of implants. That seems to get people past the risk period where infections are most likely to occur. After that, it should not be necessary unless your dentist feels it's indicated. Pain after surgery is a very normal thing. We recommend people take medications to help get them through the pain as they're going through the healing process. We've developed protocols in our office to help minimize pain. The protocols begin before surgery, specific medications are given during surgery, and also medications are given after surgery. We're well aware of the pain issues and do our best to manage the pain with the patients as they go through the healing process. We did not keep your ACL when we did your knee replacement. Most studies have shown the ACL is not necessary and not functioning at the time of knee replacement surgery. In addition, the components that we use for knee replacement substitute for the ACL, so the ACL is an unnecessary structure in the modern knee replacement. The expectation for modern joint replacements is 20 years or more in the optimal circumstances. Maintaining a healthy lifestyle will help. Maintaining a healthy exercise level and weight is also very helpful. There are many factors that go into how long a knee will last, but the expectation is that it should last most people the extent of a lifetime. Your joint components were picked based on your specific size, at your activity level, your age, and multiple other factors. There's not just one joint that fits all patients. Some people ask if they have a male joint or a female joint, and actually that's not the case. The important thing is specific sizes and specific implants that fit your specific body and your specific needs. So there's no such thing as a gender-specific joint, but rather what we like to think is a patient-specific joint. During your recovery period, you'll be given precautions to follow, which will help prevent dislocations or other complications as your body heals and the muscles strengthen. For hip replacements, the precautions generally include not bending past 90 degrees at your waist, not crossing your legs, and not turning your toes inward. For knee replacement, precautions include no kneeling, jumping, running, or twisting. For shoulder replacements, generally we recommend no heavy lifting or heavy repetitive overhead use of your arms. How long to follow these restrictions, again, depends on your treating doctor. Most of us will lift or diminish the precautions between 6 and 12 weeks after surgery. Some doctors strongly recommend that you be mindful of the precautions long term. In addition, most of us recommend that people switch to lower impact sports and activities like walking, swimming, or biking.